Good day, everyone. My name is Grace Ogala. I bring you good news from Amazing Grace Health Center. The topic of our discussion today is how to prevent diabetes, amputation, and foot care. This is a very important topic because there's a high rate of amputation among people with diabetes. Okay? With this whole story, we know already that a complication of diabetes is amputation, all right? And the main cause is elevated blood sugar, of course, uncontrolled blood sugar. It is recommended that diabetics should have blood sugar within the range of 80 to 130 before they eat, and 2 hours after eating, they should have blood sugar of 180 or less. Okay, it's this simple. But when you start seeing elevated blood sugar above this range, there is a cause for alarm. Okay, because complications of diabetes is looming somewhere. So another cause of this diabetes amputation is peripheral artery disease. Okay, peripheral artery disease is simply caused by narrowing of the arteries. Okay, there is narrowed arteries, so that means that those arteries cannot take enough blood to your legs, to your foot, okay, to your toes. So there is a problem with that. So in this case, if you have like a little wound, little sore, little blister, it will not heal properly because there's not sufficient amount of blood in that region to supply the necessary nutrients to enhance the healing of that wound or ulcer or blister or abrasion. Okay, and it's a problem. It takes forever to heal. That's not good for a diabetic at all. And also another main cause of this amputation is neuropathy, nerve damage, and is a complication of diabetes like we learned before. When there is nerve damage, the diabetic will not even feel anything now. And when this diabetic patient have a sore or wound, they won't even know that there is a wound there because they don't have feeling. So that's not good at all. And the wound will be there every day, and if the person is not paying attention to inspect the feet every day or the leg every day, the wound will be there and it will be getting bigger because more than likely there's no circulation, the nerve is damaged, and if this person don't even go and see the doctor as recommended, it's even more trouble, or see the podiatrist as recommended, it's even more trouble. That's not good at all. And eventually, maybe after he delay and now eventually went to see the doctor, what happens is that it will be too late. So that is why this topic is so important. Okay, this topic everything we're going to discuss today is going to make you realize the need to inspect your feet and see your doctor regularly, and even see the podiatrist regularly, because a stitch in time saves 9. Okay, and when there is problem, it's very easy to tell. If you do the needful, if you really inspect your feet as required. And some of the symptoms that will make you aware that there is a problem looming is when you see discoloration in your leg. Maybe you are inspecting your leg as required. You see that there are discoloration, there is swelling, there is redness, there is warmth in one area, there is pain in one area, there is foul odor in that little wound that you thought was looking good. Just know that there is a problem. And if you see that the ulcer, the wound is lasting 1 to 2 weeks, you need to be afraid. Even 3-4 days, you should be afraid as a diabetic and start calling up your doctor. Doctor, come to my rescue. And the doctor will say, come in and see me. And the doctor will look at it and see if it's infected and give you antibiotics quickly. All right? And also, if that wound is bigger than 3/4 inch or 2 centimeter, hey, it's problem. If it's not that small tiny wound that will go away sharp sharp, you have to run to your doctor, okay? And also, if there is bone showing through that wound, hey, it's problem. It's very dangerous too, okay? So my own take on this is, if you have any type of wound as a diabetic, just know it's dangerous, and make sure you try to see your doctor. If that wound does not go away in 1 week or less, please run, because if you let it stay too long, it may end up becoming something you do not wish for, okay? All right. So that being said, we will go ahead and look at the next topic carefully, because this is very important. This is where people screw up and mess up, and this is the foot care part of this discussion, and it's so important. Okay, as a diabetic, you should inspect your feet every day. Okay, inspect your feet, wash your feet. Okay, very, very important. Okay, and also dry up feet between toes. Okay, moisturize your feet, but avoid moisturizing between the toes. Trim your toenails and file down edges neatly and carefully, and inspect your feet for cuts, open or closed wounds, blisters, corns, or discoloration. As you are checking that feet, make sure it's good, it's looking good, there's no extra thing sticking out, okay? There's no discoloration, there's no foul odor, it's not cracked, it's not broken. Just check carefully, make sure there's nothing new that grew up or grew out, okay? Very important. And also wear your socks to protect your feet. Do not walk bare feet around. It's very important. If possible, put on diabetic socks. Check for sharp objects before putting on your shoes, okay? And wear the right size of shoe that will not cause injury to your feet, okay? Don't wear the ones that is too tight. I want to look good. I want to look. No. That's not for you. Wear the right size of your leg, please, okay? And avoid soaking your feet. Don't soak your feet as a diabetic, please. And avoid smoking. Smoking is not good for you. Remember when I talked about the peripheral artery disease, narrowing of arteries? Okay, when you smoke now, it's going to cause worsening situation of the peripheral artery disease, because smoking, it destroys the arteries. So you don't want to add gasoline to already burning fire. So avoid smoking. Very important. All right, I would like to tell you my story, how I learned my lesson to always wear my socks. There was a day I was feeling so excited, okay, and I took off my socks. I forgot to wear my socks. I used to. So I went to the kitchen, and guess what? The bottle of the oil fell down and broke. I cleaned up the kitchen, but there was still one hanging out in my kitchen, and it just poked my foot, and I ended up with a small wound, and it started getting bad, and I had to treat it quickly, and thankfully it was gone in less than 1 week. Okay, and I was glad that happened well, and everything went well by the grace of God. Okay, and I didn't end up with any complications of any kind. But the take-home lesson here is always put on your socks as a diabetic, okay? And I want you to do the same. And let's not forget about the rules that I always tell us about each time I make this video, is maintain healthy weight. Don't gain too much weight. If you are overweight or obese, lose 7 to 10% of your body weight. Eat healthy, half of your plate fruits and vegetable, quarter carbohydrate, quarter protein. Drink lots of water, half of your body weight, okay? And also exercise at least 30 minutes a day. Good dental care is important for you. See the dentist regularly. And stress management is important. Sleep adequately 6 to 8 hours. And don't forget to see the podiatrist. That is so important. See the podiatrist regularly, at least twice a year. okay, and see your doctor as recommended. Take all your medications that are prescribed, okay, and your doctor will inspect your foot, inspect your leg, if you go for all these appointments, okay. You are very special, and I want you to take care of yourself in a very special way. And so I pray that God will heal us spiritually and physically, and our families as well, in Jesus' name. Please follow me on all social media outlets where you find my name, Amazing Grace Health Center or Grace Ogala. Until we meet again, it's goodbye for now. Thank you so much for listening to me. Bye-bye.